Hello everyone, Dr. Jaime Trent here. Welcome to day 8 of our detox program. So today we're going to talk a little bit about cholesterol in the liver. But first I want to mention day 8, you're going to start seeing some changes in your programs. So on the 28-day SP detox balance, this should be your first day of going up to 3 servings of that protein powder per day. So for some people, that's a little too much. So if you're feeling like it, but a lot of people I tell, go ahead and try the 3 a day for like 2 or 3 days. Some people, it'll kind of push that detox a little bit more. So you may feel a little bit more bloated and some other things for a day or so. But then a lot of times if you kind of get through, you start feeling a lot better. But for other people, just keeping it at that 2 a day is just fine and they get great results. So that's just going to kind of depend on you. If you don't want to drink it 3 different times a day, you can just do 2 servings. And you can actually just put 3 scoops into each shake. So you can do that. That's not a problem. So now on the 21-day purification program. So this one is, today should be the day you should have like about 3 SP cleanse left. And you're going to be switching over to that green food. So just go ahead. You can just take what you have left of the SP cleanse. If you haven't forgotten any of your doses, of course. If you've forgotten to take a few of your SP cleanse doses, continue taking that until you're out. But if you're ready to switch, today we'll switch over to that SP green food. And remember, this one is 5 capsules only twice a day. The SP cleanse was 3 times a day. This one is only twice a day. So your gastrofiber and your SP complete all stay the same. It's the only thing that's changing. So now hopefully by this time you're feeling amazing. Like I said, some people when they increase that SP detox balance again, they might get a little bit of bloating or something. But really by this point, your brain should be clear. You should be sleeping better. Your energy should be better. Appetite may be a little bit more stable. You're not overeating, not craving, and things like that. So, but if you're still struggling with some things, that's okay. But I'm just hoping that you at least feel better and are seeing improvement. Of course, always let us know how you're doing with that. Also, let me know if you guys had any side effects with even last week. So with the the 21-day purification program, it seems like if anybody's going to have anything, it's usually on about day 3 or 4. It's amazing how it's pretty much those days, but then they just start feeling better. So I always like to kind of get feedback. So let me know if you kind of had anything, and it can be a headache. It could have been a skin rash that popped up. It could be your joints maybe got achier for a day or 2. So kind of let me know. So next, we're just going to talk, like I said, about cholesterol. So a lot of people don't understand cholesterol. They think that the only reason your cholesterol goes up is because you are eating too much in your diet. And really what cholesterol we consume in our diet really does not affect our blood cholesterol that much. So now genetically, though, some people will absorb more. But when we're talking about cholesterol, the total number is not as important as the ratios. So when we look at cholesterol, whenever you just go to your doctor, have your cholesterol run, there's usually kind of 4 main markers we talk about: total cholesterol, HDL, LDL, and triglycerides. Those are the main 4. So total cholesterol, my range, I like to see it about 180 to 250. But then when I'm looking at it, like I said, if you're close to 250, I'm not going to get too worried unless I start seeing the ratios that I don't like. So where I like things to be, I like your triglycerides. So triglycerides are actually fat in the blood, but really they usually elevate more because we're overeating carbohydrates and sugar. So it's just kind of how our liver transports different energy through the blood. So triglycerides should be about half your total cholesterol. Then your LDL, bad cholesterol, I'm going to go into a little bit more in a minute, should be about 100 points less than your total cholesterol. So if I'm seeing the ratio, so if your cholesterol is sitting at 240, but those ratios look good, I'm not going to worry about it. I'm like, great. And I feel like some MDs and doctors are starting to look at that a little bit more, and they're not pushing the statins quite as much, but it really just depends on the doctor. So, okay, so then when we break it down, we're talking about that HDL and LDL. HDL is termed our good cholesterol. LDL is termed our bad cholesterol. So not fair because we need both of them. But like I just mentioned, we need the proper ratios here. So what happens is the reason our cholesterol and especially that LDL start to elevate is because when our arteries start to get inflamed from either lack of nutrition, too much, your blood sugar's running too high, So, and blood sugar is just a good example. So if your blood sugar or your glucose is running too high, it's almost like having shards of glass in your arteries. So now this glass is going through and it's constantly causing scratches and nicks in your arteries. So your body needs to heal that. And how it does that is it uses LDL. So the first thing it does is it mobilizes LDL. Their LDL is big and bulky and comes and kind of sticks to the side of the artery. So then what's supposed to happen is your HDL should then come by, kind of smooth that down and take the excess LDL back to the liver to get rid of it. So that's what should happen. So, and as you can already see, if you don't have enough of that HDL, that good cholesterol, to balance that LDL, that's when we're going to start getting more plaquing, more problems in there. And the reason they've always said the LDL is bad is because every time they find a clot or something, it's always that LDL cholesterol. But LDL is just as important to our health as anything else. If we try to push it down, and I've seen it low on some people taking statins, then that is going to really affect our health in other ways. So for one, it's very important for our brain health. Our brain needs LDL to function. So having that pushed down too low is going to increase your chances of dementia. Also neuropathy. So I found a study that said actually people with very low levels of LDL cholesterol had an increased incidence of peripheral neuropathy. So that's another one that's very concerning. So we want to make sure that we're not pushing those down too low. So let's talk real quick about statins. So statins, a lot of doctors really push them, and a lot of doctors feel like your cholesterol and your LDL cannot be too low. I completely disagree. So like I said, total cholesterol, I never want to see it below 180. If you've got your total cholesterol below 180, you're not able to make things like hormones. You can't make vitamin D. You can't make cortisol, which is one of our stress hormones. You can't make sex hormones such as testosterone and progesterone. So we really want to make sure we're not pushing those down too low. But like I said, if you need to, and I always tell people, it's not that you want to ignore your cholesterol, but you need to take active measures to help balance that and get the cholesterol down instead of just going in and taking a statin. And a statin is just like a Band-Aid. It's just going to cover up that symptom. And they found that it really is not going to lower your incidence of cardiovascular disease or heart attacks or strokes, because the problem that was causing that cholesterol to go up is still there. And like I said, it can be anything. It's usually the most common thing I see. It's usually a blood sugar issue. But it can also be just anything that's causing inflammation in the body. So we've got something called C-reactive protein that's elevated. That can cause issues with the cholesterol. Any type of infection, stress, like I said, not having enough omega-3s in your diet, that can also cause them to be low. And a big one that we're seeing is actually if your vitamin D is too low, that can cause your LDL to really start to go up. So those are just some, like I said, there's more. So, but we're trying to really get vitamin D levels up to close to 80. And that's been actually working really well at helping balance those lipid levels. So, okay, guys, hopefully that was helpful. The only one last thing I do want to mention is real quick on statins. So statins, we see a lot of side effects with statins. Medical doctors and cardiologists, they don't really think that they cause that many side effects, but we do see a lot. We see a lot of muscle fatigue, muscle weakness, muscle wasting, and things like that. And the concern is that it can take years to start happening. So some people say, well, I've been on this for years, so that can't be causing the problem. Yes, it can, because over time, statins start to deplete something called CoQ10 in your muscles. And that can take time to actually start showing symptoms. So it's just something to always keep in mind. Like I said, our goal is always kind of try to maybe get you off those medications, but sometimes they are needed. So, okay, guys, we'll hope you have a great rest of your day.